Every year, millions of people over 60 walk into their doctor's office for routine checkups, believing it's the safest way to protect their health. You trust the white coat, you trust the machines, and you trust that every test is designed to keep you alive. But what if I told you that some of these very diagnostic tests can quietly carry a hidden stroke risk from medical tests? What if the very thing you thought would protect you might actually harm you? I remember a woman, 74, who shared through tears, "My sister died 15 minutes after the Treadmill stress test." That sentence still echoes in my mind because it's not an isolated story. Seniors across the country whisper the same regrets. "I wish I'd known. I will never do one again." These aren't fears from strangers. These are voices of mothers, veterans, neighbors, people just like you. Medical research supports their pain. A study in the American Journal of Cardiology found that nearly 7% of patients over 65 undergoing treadmill stress tests experienced harmful events, from blood pressure spikes to abnormal heart rhythms. And it's not just stress tests. From CT scans with contrast dye that strain fragile kidneys, to sedated endoscopies that disrupt circulation, to MRI contrast lingering in the brain. Each carries silent dangers no one warned you about. If you are over 60, this message is for you. Because your health journey is no longer just about catching problems early. It's about avoiding the ones that modern medicine might accidentally cause. And here at Stroke and Heart Attack Knowledge, we're going to uncover these hidden risks together so you can protect not only your life, but the independence you've worked so hard to keep. When you're sitting in that cold room waiting for a CT scan with contrast, the nurse gives you a small injection. Within seconds, a warm flush spreads through your body. Many seniors over 60 describe it as harmless, just part of the process. But here's what most people are never told. That little injection can put enormous stress on your cardiovascular system, especially if you already live with high blood pressure or fragile arteries. One of my patients whispered after his scan, "Doctor, I felt dizzy, but no one warned me." This isn't rare. It's the hidden danger that too often goes unspoken. And for seniors, that silence can change everything. Let me share a true story. An 81-year-old man went in for what was supposed to be a simple abdominal CT scan with contrast. He had mild stomach discomfort, nothing serious. The scan came back normal. He walked out relieved, believing he was safe. But just 2 days later, he suffered a minor stroke. Doctors suspect that the contrast injection temporarily spiked his blood pressure, leading to a clot that blocked blood flow to part of his brain. Imagine how betrayed his family felt, doing the right thing, only to face the very outcome they feared. For many over 60, that's the nightmare. Trusting medicine, yet walking into a trap no one explained. The science backs this up. A study in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension or impaired kidney function. Your kidneys act like a filter, clearing out toxins and chemicals. But after 60, that filter naturally weakens. If the dye lingers too long, blood pressure can rise, vessels can tighten, and in some cases, a clot may form. Seniors with high blood pressure or kidney disease are not exceptions. They are the ones at greatest risk, and often the ones never warned. For seniors already on medications like aspirin, Plavix, or Xarelto, the risks multiply. Contrast dye can disrupt circulation, while blood thinners make clotting unpredictable. One woman told me, "I wish I'd known to tell them about all my medicines. I thought they already knew." This is the reality. Doctors move quickly. The test is routine, and sometimes critical details slip through. But you have the right to stop and ask, is this scan essential for me, or is there a safer option?
In many cases, a non-contrast CT or even an ultrasound can give your doctor the information needed without exposing you to unnecessary stroke risk. Think of it this way. Contrast dye is like a sudden surge of electricity flowing through old, fragile wires. In a brand new house, the system can handle it. But in a home that's weathered decades, just like the body after 70, that surge can cause sparks, shorts, or worse. Your body deserves the same caution. Before every test, share your full history, especially kidney problems, heart disease, or past reactions. Ask your doctor, can we do this without contrast? You may be surprised how often the answer is yes. Sometimes the safest choice isn't to add more, but to keep it simple. This doesn't mean CT scans with contrast are bad. They can detect cancers, aneurysms, and blood clots, findings that may save lives, but they should never be ordered casually as part of a routine checklist. The real danger comes when tests are done just in case, without weighing the risks. If you're over 60, your body responds differently than it did at 30. What seems routine may carry silent costs. At Stroke and Heart Attack Knowledge, our mission is not to scare you, but to arm you with the right questions so your next scan protects your health instead of putting it in danger.
On paper, the treadmill stress test sounds simple. You put on a monitor, walk on a treadmill, and your doctor checks how your heart responds. But if you are over 60 with high blood pressure or existing heart disease, this test can feel like striking a match near dry grass. One subscriber once shared through tears, "My sister died 15 minutes after the treadmill stress test." That sentence captures the fear of so many families. What was meant to reassure ended up taking a life. These aren't distant stories. They're warnings from real seniors who trusted the system only to learn too late about the hidden risks. The danger lies in how the body reacts under sudden strain. As the treadmill speeds up, your heart rate rises, your blood pressure climbs, and your arteries are pushed to their limit. For a 30-year-old athlete, this is no problem. But for a 70-year-old veteran with fragile vessels, it can trigger spikes, irregular rhythms, even tears in tiny brain vessels. A 2020 study published in the American Journal of Cardiology looked at over 1,300 patients older than 65. Nearly 7% experienced harmful events during the test, from abnormal heartbeats to dangerous surges in blood pressure. Behind every statistic is a face, a family, and often regret. Margaret, 74 from Ohio, had lived with hypertension for years. Her doctor recommended a stress test just to be safe. Halfway through the treadmill, she felt dizzy and complained of chest tightness. The test was stopped immediately. But by the next day, she had suffered a minor stroke. Doctors believed the sudden rise in blood pressure during the test ruptured a tiny vessel in her brain. Margaret survived, but now she struggles with weakness on her left side. Her story is a painful reminder. For seniors with underlying issues, pushing the heart too hard, too fast, can turn a simple checkup into a lifelong disability. This is not to say the treadmill stress test is useless. For some patients with unexplained chest pain, it can provide important answers. But for many seniors who feel well, it may do more harm than good. The real issue is overuse, tests ordered just in case, without considering safer alternatives. If you are already on blood pressure medication or statins, if you have known vascular disease, your doctor may already have enough data to manage your risk. Sometimes the safest choice is not to stress the heart at all, but to use gentler tools that respect the limits of an aging body.
So what can you do? Before agreeing to a treadmill stress test, ask your doctor, is there a safer way to evaluate my heart? In many cases, a nuclear stress test, where medication simulates exercise, or a resting echocardiogram can provide the same information without forcing your heart into dangerous strain. Always share your full history, especially if you have had dizziness, chest pain, or fainting spells in the past. Your voice matters. Asking questions does not mean you are difficult. It means you value your life and want to choose the option that protects you best. That is your right.
If you have no symptoms, no chest pain, no shortness of breath, no fatigue, don't be afraid to ask whether the test is truly necessary right now or whether it can wait. Seniors deserve choices, not blind protocols. A treadmill stress test can be life-saving for some, but dangerous for others. At Stroke and Heart Attack Knowledge, we believe awareness is protection. The more you know, the safer you are. Because every heartbeat after 60 is precious, and no test should ever gamble with it. Coming up next, we'll look at another routine procedure, one involving sedation that may quietly raise your stroke risk.
An endoscopy sounds routine. Your doctor wants to look inside your stomach, colon, or esophagus. They assure you it's quick, safe, and you'll sleep through it under sedation. But if you are over 70, especially on daily medications like aspirin, Plavix, or Xarelto, that sleep can turn into something much more dangerous. Sedation naturally lowers blood pressure and slows circulation. When combined with blood thinners, it can quietly create the perfect storm for a transient ischemic attack, or TIA, or even a silent stroke. Too often, patients are not told about these risks. What feels like a harmless test to be thorough may actually carry consequences that last a lifetime.
Consider this case. A 76-year-old woman went for a routine colonoscopy with sedation. She had no major symptoms, she was just following her doctor's advice. 2 days later, she began slurring her speech and lost her balance. At the ER, tests confirmed she had suffered a mild stroke. The doctors believed the drop in blood pressure during sedation, combined with her daily aspirin, had allowed a clot to travel to her brain. Her story echoes the words many seniors regretfully share. Sometimes, doing nothing might have been safer. This is not meant to frighten you, but to reveal a reality that too many older adults face after procedures they never truly needed. The science supports these concerns. A large-scale 2021 review in gastrointestinal endoscopy found that patients over 65 who underwent sedated procedures experienced a significantly higher rate of transient ischemic attacks, TIAs, within 72 hours. These weren't always full-blown strokes, but they were clear warnings that blood flow to the brain had been disrupted. Even a so-called mini-stroke can leave lasting problems: confusion, weakness, memory loss. Another study in older patients found that even brief drops in blood pressure during sedation were linked to temporary neurological changes. Yet brochures rarely mention this, and too often doctors overlook the unique vulnerabilities of the senior health population.
For seniors on blood thinners, the danger grows sharper. Sedation alters circulation, while thinner blood raises the chance of internal bleeding or brain circulation problems. One veteran told me with regret, "I trusted the hospital, but no one warned me. I wish I had asked more questions." His voice mirrors the fear of many seniors who learned too late. But you don't have to repeat that mistake. Before any endoscopy, tell your doctor about every medication you take. Ask, will I need to stop my blood thinner before this? What risks does sedation pose for someone my age? These questions may feel uncomfortable, but they could save your independence.
There are alternatives. Some procedures can be performed with lighter sedation, or even without sedation if the patient is willing. In some cases, non-invasive imaging, such as an ultrasound, may provide the needed answers without the same risks.
Being proactive does not mean refusing every test. It means understanding when the benefit outweighs the danger. For many older adults, avoiding unnecessary sedation could be the difference between leaving the hospital walking on your own or facing months of rehabilitation. Even if you feel perfectly healthy, sedation after 70 can tip the balance. That's why awareness is not fear, it's protection. Endoscopies save lives when used wisely, detecting cancers or dangerous bleeding. But they should never be performed just in case, without clear reason, especially in seniors with multiple medications. If you ever feel pressured, remember you have the right to ask, why do I need this now? What happens if we wait? These simple questions can prevent unnecessary risk. At Stroke and Heart Attack Knowledge, we believe informed seniors make stronger choices. Not every test is dangerous, but not every test is necessary either. Sometimes the most courageous act is pausing, asking questions, and choosing the path that truly protects your health and your future.
When most seniors hear the word MRI, they breathe a sigh of relief. Unlike CT scans, it doesn't use radiation, and it promises answers hidden from the naked eye. But when the doctor adds the words, "with contrast," everything changes. That contrast dye, often made with gadolinium, depends entirely on your kidney function to leave the body. After 60, kidneys naturally filter more slowly, even when routine blood tests still look normal. If the dye lingers too long, it can circulate in the blood, settle into tissues, or even remain in the brain. What seniors are rarely told is that this lingering can quietly trigger dizziness, confusion, or stroke-like symptoms, risks that are invisible until it's too late. Harold, a 79-year-old veteran from Arizona, never expected trouble. He went for an MRI with contrast to check persistent back pain. The scan itself felt easy, and he left the hospital with reassurance. But 2 days later, Harold felt weak and disoriented. He couldn't remember simple words, and his wife noticed he was unsteady on his feet. Eventually, tests revealed stage 3 kidney disease, something Harold had never been told he had. The contrast dye had remained in his system, stressing his circulation and affecting his brain. Harold's story is one that seniors over 70 need to hear because it shows how quickly trust in a safe test can turn into regret and lasting health problems.
The science supports these fears. A 2019 study in the journal Radiology tracked more than 2,000 patients over 65 who underwent contrast-enhanced MRIs. Within just 1 week, about 5% reported stroke-like symptoms, blurred vision, dizziness, balance problems. While not every case was a major stroke, these events were warnings that circulation to the brain had been disrupted. The data showed seniors with hypertension, diabetes, or reduced kidney function faced the highest risks. Many didn't know their kidneys were already weakened until after the scan. For patients over 75, even mild impairment can mean the dye lingers much longer. These numbers are not abstract. They represent real people who thought they were safe, but ended up shaken and afraid. Researchers have also found traces of gadolinium in brain tissue years after repeated scans. While scientists are still studying the long-term effects, many seniors report new issues after contrast: sudden memory lapses, confusion, headaches that never seem to go away. One woman told me, "I thought it was just aging, but it began right after the MRI." Imagine carrying a heavy metal inside your brain without ever being warned. For those already worried about stroke, dementia, or loss of independence, this possibility feels frightening. Yet in many exam rooms, it's never mentioned. Patients sign the consent form, close their eyes, and place their health in hands that do not always disclose the full picture.
But you are not powerless. If your doctor recommends a contrast MRI, ask first, can we do this without contrast? In many cases, non-contrast images can provide enough information. If contrast truly is essential, request a GFR blood test to check kidney function before the procedure. Seniors over 75, especially those on blood pressure medication or living with heart disease, should insist on this step. Always share if you've ever reacted poorly to imaging tests. Protecting yourself does not mean saying no to care. It means asking the right questions so that when you say yes, you know the risks have been measured against your body's limits.
An MRI with contrast can save lives when carefully chosen. It can uncover cancers, aneurysms, or clots that might otherwise remain hidden. But it should never be ordered casually, just to be thorough, especially in seniors over 60 whose bodies no longer process chemicals the same way. You have the right to pause and ask, is this truly essential? Are there safer alternatives for me? At Stroke and Heart Attack Knowledge, we believe informed patients make stronger choices, because sometimes what protects one person may harm another. And every senior deserves to know the difference before it's too late, before trust in a test becomes the trigger for a silent stroke.
The carotid ultrasound sounds like the perfect test. It's painless, non-invasive, no needles, no radiation. Just a quick scan of the arteries in your neck to check for plaque. Many seniors over 60 agree to it without hesitation, thinking, better safe than sorry. But here is what isn't always explained. Finding plaque doesn't always mean you're in danger, and sometimes knowing about it can actually lead to harm. For an 82-year-old woman who felt perfectly healthy, the scan showed 65% narrowing. Within weeks, she was sent for surgery. During the procedure, she suffered a stroke. Her words after still haunt me. I wish I'd known that doing nothing might have been safer.
Plaque buildup in the carotid arteries is common with age. It's like wrinkles on the inside of your blood vessels. Most of the time, it doesn't cause symptoms and can be managed with medication and lifestyle changes. But when a test shows moderate narrowing, fear sets in. Families hear the word blockage and think immediate surgery is the only way forward. Yet studies show this is not always true. A major trial published in the New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing, but no symptoms. In many cases, surgery did not reduce the risk of stroke more than medication alone. Worse, some patients had strokes during or right after surgery.
Helen, 82, from Pennsylvania, trusted her doctor completely. She had no dizziness, no vision problems, no weakness, just a routine checkup. Her physician suggested a carotid ultrasound just to be thorough. When the scan revealed 65% narrowing, fear took over. Within weeks, she was scheduled for an endarterectomy. But during surgery, she suffered a stroke that left her with weakness on her right side. Helen now lives with daily reminders of a decision she never thought to question. Her story reflects what many families face, a well-intentioned test that spiraled into a life-changing event. For seniors without symptoms, sometimes the most dangerous path is the one paved with unnecessary procedures.
This doesn't mean the carotid ultrasound has no value. For seniors with symptoms, like sudden vision changes, slurred speech, or weakness, it can be life-saving, pointing directly to the cause. But when used on people who feel well, the test often leads to what experts call overtesting. Once plaque is discovered, doctors feel pressure to fix it, even when fixing may cause more harm than watching and waiting. For seniors already on blood pressure medication, cholesterol drugs, and statins, the risk is often well managed without surgery. But few patients are told this. Instead, they are rushed down a path that feels urgent, when in truth,
patients may offer the safer outcome. So what should you do if your doctor suggests a carotid scan? Ask first, what are we looking for? And what will happen if we find it? If the answer is vague or simply to check, pause before agreeing. If you already have a diagnosis of high blood pressure or are taking cholesterol medication, chances are your risk is being controlled. Request a second opinion before considering surgery. Sometimes repeating the ultrasound in 6 or 12 months is enough to monitor changes. Remember, a test that does not change your treatment plan may only add anxiety, and anxiety alone does not prevent a stroke.
The truth is, not every test is dangerous, but not every test is necessary either. Especially after 60, every decision should balance risk with benefit. The carotid ultrasound can save lives when symptoms demand it, but it can also lead healthy seniors toward operations they never needed. At Stroke and Heart Attack Knowledge, our goal is not to scare you, but to help you protect yourself. You have the right to ask, is this essential for me? Or is there a safer alternative? Because sometimes protecting your health means saying yes. And sometimes the bravest act is saying no to a test that offers more harm than hope.
As we come to the end of this journey, I want you to remember how it began. We asked a simple but unsettling question. What if the very tests meant to protect you could quietly increase your stroke risk? You've heard the stories. An 81-year-old man who suffered a stroke 2 days after a CT scan with contrast. Margaret, who collapsed after a treadmill stress test. A 76-year-old woman who never expected a sedated endoscopy to trigger a mini-stroke. Harold, the veteran whose kidneys failed him after an MRI with contrast. And Helen, whose routine carotid ultrasound led her straight into unnecessary surgery. These are not isolated accidents. They are reminders of the hidden danger in checkups after 60.
The truth is sobering, but empowering. Medical research, from the American Journal of Cardiology to the New England Journal of Medicine, confirms what many seniors whisper in regret. I wish I'd known. Doing nothing might have been safer. These insights matter because they give voice to what so many of you feel, that you are not always told the full story. But knowledge is power. If you are over 60, your body reacts differently to chemicals, sedation, and stress. A dye that a younger patient clears in hours may stay in your kidneys for days. A treadmill that challenges a 40-year-old can rupture a vessel in someone your age. Awareness doesn't take away the fear, but it transforms fear into protection.
So what can you do? The answer is not to refuse every test, but to pause and ask the right questions. Is this essential? What happens if we wait? Are there safer options for someone like me?
Sometimes the alternative is a non-contrast MRI, an ultrasound instead of a CT scan, or simply repeating a test later instead of rushing into surgery. Sometimes the answer is adjusting your medication first. You are not being difficult, you are being wise. For seniors who already take blood thinners or live with kidney disease or high blood pressure, these questions may be the single step that prevents a stroke. Protecting your health is not about doing more. It's about doing what truly matters. At Stroke and Heart Attack Knowledge, our mission is simple: to uncover what others don't say, to give you the tools to protect your independence and your years ahead. Because health is not just about numbers on a chart. It's about the mornings you wake up clear-minded, the walks you take without fear, the memories you keep sharp. Not every test is dangerous, but not every test is necessary either. The bravest seniors are not the ones who say yes to everything, but those who pause, demand clarity, and choose with confidence. If you've ever had a strange reaction after a test, or watched a loved one suffer unexpectedly, share your story. Together, we can turn hidden risks into shared wisdom.